So the next Ask ID is, I have a tendency to have sensitive skin. I had eczema when I was a child, but I'm now breaking out with a rash on my face that is tiny little spots that are slightly itchy. It started on the side of my nose and now I have a little bit on the side of my lip. So obviously without seeing someone, this is a little bit difficult to tell, but for some people who develop small little spots, which sometimes they think is an acne breakout at the side of the nose or the side of the mouth, can also happen at the side of the eyes, which is slightly itchy. This can be periorificial dermatitis. Now it can just be separate for periocular, perinasal or perioral dermatitis, where you just get it localized to either one side or both. But really this is a super common problem that we're seeing over and over again in the recent past. It can be triggered by a lot of reasons. Things like putting steroid on other parts of your body and then by accident putting them on your face. It can be due to inhaled nasal steroids, or people that are using inhalers for asthma, for example. It can be due to whitening toothpaste. It can be due to lots of skin actives, using too many too quickly, such as vitamin C, retinoids, maybe too much acids on the face. Anything that can impair the skin barrier. And it can also be triggered due to hormonal changes, so before or after pregnancy, or coming on or off the contraceptive pill. And we certainly do see a lot where people have done nothing except they may be very stressed. So the most important thing is, if you have a skincare routine that has any actives, you need to strip it right back, and then you're going to start with basic skincare to try and repair that barrier. So some of my favorites from a cleansing point of view would be the CeraVe hydrating cleanser. Nice and gentle, suitable for acne prone skin and rosacea, eczema, and of course if you've got periorificial dermatitis. My actual personal favorite that I use all of the time is the Elta oil and gel cleanser. Lovely oily texture to take off my makeup and sunscreen at the end of the day, and a creamy kind of milky emulsion when you add the water to wash your face. Then it's really important that you're moisturizing, preferably with ceramides, to help to recreate that skin barrier and fix it more quickly. One of our go-tos would be the Barrier Renewal Complex, great for post-procedural skin and for anyone who has a skin barrier dysfunction. And I also love this one for overnight. It's not too heavy, but it is a skin recovery night mask. And overnight, that's when you do all of your skin repairs. It's really important that you're putting on your moisturizer before you go to bed. And the most important thing is to not forget your sunscreen. And the UV Elements is my absolute favorite. This is a physical only sunscreen, so a combination of zinc and titanium dioxide, so no chemicals whatsoever for a person who has an impaired skin barrier while you're trying to wait for it to repair. The other thing I love about this is it has your hyaluronic acid in it, so it's hydrating you, but also it has a very light tint that adapts to your own skin tone. So if you are having a breakout with periorificial dermatitis, you're going to have some redness in these locations, and it just helps to mask that while you're waiting for your skin to improve. Now, of course, if everyone's doing the right skincare and you still don't improve, there are lots of topical therapies and oral medications that we can prescribe. So if it's really not settling and you've been good with skincare, then you